Hi guys, welcome back to my channel. My name is Shawn Vasquez with Mother's Nature. For this episode, I'm taking a little break from the childbirth education series that I have been working on, and I just wanted to take a step back and talk a little bit about what inspired me to start this channel in the first place and how I became interested in childbirth education and midwifery studies. As you can see, I am outside trying to enjoy what is left of this beautiful spring day. And I didn't really plan this video out so much. I'm trying to kind of come to you a little more casually and a little more from the heart. I had been working on what's supposed to be my next video, which is about how to choose a healthcare provider during pregnancy. And I kept kind of coming back to this topic, and it's sort of been nagging at me the whole time. So I sort of had to force myself to take a break from that and kind of get this out there, and then I might be able and then I think I'll have better luck getting back to it. And why I think this is so important is because I think it'll give everyone a little bit of perspective as far as where I'm coming from with this information and what inspires me to be putting it out there and what my motivations really are. And I also just think that it is a really good starting point for the rest of the information that I plan to provide. And I'm not really sure why I didn't make this as my first video, but nevertheless, here we are. The first thing I want to do before I get into this is kind of make a statement about how I feel about the medical community in general, I guess. I think there's a lot of misconception out there about how I or other people in the kind of natural childbirth community feel about the medical community and doctors in general. And I think a lot of people think that I'm anti-doctor or anti-medicine or anti-hospital, and nothing could be further from the truth. I am so grateful that we have the advances in medicine and science and technology that we have that make it possible to save so many lives. I am so grateful that people who are in a medical emergency have the access to the medical care that they have in the United States. We have some of the greatest doctors and surgical teams in the world. The kind of healthcare that we have access to isn't even thought of in some countries. And what obstetrics and gynecology has done for the childbirth community over time, the amount of knowledge and information that we have gained from those medical fields is just incredible. So I am not at all anti-doctor, anti-medicine, anti-hospital. I am against birthing people not having choices, against birthing people not being given informed consent. I'm against human rights being taken away. And those are the kind of things that are happening here in the United States today. There are incredible injustices in the childbirth world happening every single day. And I know that a lot of people might think I sound like a conspiracy theorist or just a crazy person, but if you had seen the things that I have seen happen to people who are in the most vulnerable position that they have ever been in, you would be appalled and you would be just as angry as I am. And that's one of the main reasons I wanted to make this video today, because I wanted to make sure that everybody understands where I'm coming from, that I'm not coming from a place of negativity about the medical community in general. It's coming from a place of trying to empower and educate and inspire pregnant and birthing people to make informed and educated decisions, to make safe decisions, to be aware of what rights they have and what decisions they even can or need to make. I am not trying to impose my opinion on anybody. I don't feel like the things that are right for me are right for everybody. I want you to have the information that you need to make the choices that are right for you, the choices that support your values and your beliefs. So with that being said, the childbirth crisis that I am referring to is a multi-layered issue. There's not just one thing that led me here. It's so many things, and the further I get into it, the more things I find. And I know that that can be said about a lot of different topics, but I feel like this is a really important one and it affects so many people. So the first issue is the narrative that we have in society about childbirth in the United States. And that is that childbirth is this medical emergency that requires intervention, that is this terrible, horrible thing surrounded by fear and danger. And it is simply not true. If that were the case, if childbirth were so horrible and so dangerous, none of us would be here today. We all are the descendant of somebody who was born at home to a woman who was not attended by a midwife or any kind of professional at all. In most cases, childbirth is a totally normal, healthy, safe event that can happen with absolutely no interventions at all. And I'm not saying that's the kind of birth that everyone should have. You know, everyone should have the kind of birth that they want. But what I'm saying is that we have created this narrative that implies that childbirth has to happen in a hospital, that it's unsafe to happen outside of a hospital or without all these interventions. And it's really very dangerous to create this attitude because it makes somebody feel very, very vulnerable. And when you're vulnerable, you're not able to stand up for yourself, and you kind of let things go that you wouldn't normally let go. And you can be pushed into making decisions that you might not want to make, or making choices differently than you would normally have made them. And it's just a really very dangerous thing. And the second thing is the lack of information and the lack of education that we have in our generation, in society in general, about childbirth, about pregnancy. It's something that is so important in our lives, but something that is so little researched by the average person. I think that a big part of it is that it's become such a medical event. It's become this thing that we feel like is controlled by doctors and the medical society, so we don't feel like we have to do the research because the doctors will give us the information that we need. We trust them. We rely on them to kind of guide us through the process. So many pregnant people that I meet, when I talk to them about things that are very important topics and very important issues that they need to be aware of and that they need to make decisions on, they don't even know that those things exist. They've never thought about them. You know, they have no intentions of researching those things or looking into them at all throughout their pregnancy. And so when you combine that kind of false narrative and that fear-based mindset with somebody who is uneducated and uninformed about childbirth and the whole experience, you have a huge problem. You have somebody who doesn't feel in control, who's not very empowered, who doesn't think this is something that they can do on their own. So then add to that childbirth is in fact a business for the medical community, a very profitable business at that. And I'm not saying the doctors are in on it or that doctors are bad or evil. I do believe that doctors go into the childbirth field because they truly do love it and they do want to do what's best for people. But I think that their hands get tied by policy and by procedure that is passed down from people who hold financial stake in the hospital as a business. And so it doesn't always matter if the doctor's a good doctor or what they believe. Sometimes they have to follow policies or procedures that aren't necessarily ethical. And again, that doesn't mean that I think that all doctors or all medical staff or everyone involved are these evil, horrible people. I'm just saying that when there's money involved and when money is being made, things happen differently. When childbirth was originally brought into the hospitals, it was for that reason. It was because it was profitable. They realized how much money could be made from it. It wasn't because it was this medical thing that needed, attention, we need doctors present at births. It wasn't about that. It was, because they realized they could be making a lot of money off of it. And then it became this normal thing that everybody did. And it's not just profit. A lot of it is about liability too. Our society is so litigious. People sue at the drop of a hat about anything, any opportunity that they can. So a lot of the policies and a lot of the procedures that are put in place are for that reason. They're not necessarily to make sure you're safe, it's to make sure that the hospital is safe. And a lot of times, and more times than you want to believe, those things actually really do conflict with one another. What's best for the hospital is not always what's best for the birthing person or for the baby. One of the first resources that I give to all of the pregnant people that I work with in my doula business is this article in the Journal of Perinatal Education, and it's called First Do No Harm, and it is based on the sentiment in the Hippocratic Oath that all medical professionals take. It talks about how this series of interventions begins from the moment that you walk in the door until the moment that you leave, and how it creates kind of a domino effect. And so, it starts with recumbent laying in the bed and kind of being forced into the bed, the electronic fetal monitoring that's constantly, all the machines that you're hooked to, catheterization, IVs, things that prevent movement. It talks about not being able to drink or eat in labor, medical inductions and medications like Pitocin to jumpstart or kickstart contractions in labor. And it goes on from there. What it's talking about is how medical professionals need to be weighing the risks versus the benefits of these interventions. Are they being done because they're convenient, or are they being done because they're necessary? And could there be risks that might actually outweigh the benefits of these interventions? So many of these things have become commonplace that a lot of people don't even know they have a choice in the matter, or that there's a decision to be made. And that's a big part of why I'm here, is to bring awareness to these different interventions that have become part of the norm, these procedures that really aren't necessary. And in the first Do No Harm document, they give scientific evidence for each intervention and showing, when is it necessary? When is it not necessary? What are the risks? What are the benefits of it? And a lot of times what the policy and the procedure that is the norm in these hospital settings is absolutely 100% the opposite and against what the science and what the evidence says. And that's where a lot of my passion lies, because I see people walk into this situation and they're completely bombarded by all of these things and they have no idea what's about to happen to them. And I've attended the childbirth classes at the hospital that they give you to prepare you for these situations. And they present a lot of these things as if they are not a choice, that these are things that you have to agree to or that you have to do. And it is simply not true. Because I believe that every person should have the right to birth where they want to, in the environment that they feel the most comfortable and the safest in. And so if you're going to birth in the hospital, you need to have this information so that you can be aware of these things and what's going to happen, so that you can make the choices that you would feel best about. I see people after the fact all the time. I have heard so many horror stories, so many birth stories that ended in the birthing person feeling like they were traumatized, like they had been through this awful traumatic event. And that is not at all how you should feel. And I'm not just talking about when there's a medical emergency that caused the birth to go a different way than, they had planned. Because of course that comes along with a lot of trauma itself. I'm referring more to issues where there was not consent, or things that were done completely against the wishes of the patient. I truly feel for these women, and my heart hurts, and I think about it all the time. And it is what motivates me to continue researching, to continue trying to educate people, to be there to support birthing people in their time of need when they are most vulnerable, to make sure that they have the information that they need so that they aren't forced into anything that would make them feel like they had an experience that wasn't their own or wasn't what they wanted. Because I didn't have the traditional pregnancy and childbirth experience, or what is considered traditional here in the United States anyway, because I chose to birth outside of the hospital with a midwife. When I go now with my doula clients to their prenatal visits with OBGYNs, or when I attend a birth in the hospital, I see things and I hear things that just completely shock and put me in awe. I mean, I have seen doctors actually laugh in the face of people when they tell them they have a birth plan. Because how ridiculous is it for a pregnant person to want to have control or to have any say in how their childbirth experience goes? I have seen them laugh at them when they tell them they don't want any pain medication during their childbirth experience, and actually mock them for it. I have seen procedures done without consent. I have seen procedures done that were specifically asked not to be done. Premature rupture of membranes, waters being broken without anyone even mentioning it was happening, episiotomies without any kind of consent. It's really quite terrifying. And that kind of brings me to the last point I want to make, and that is the maternal death rate in the United States. Currently, about 700 women a year die during or shortly after childbirth in the United States. When you compare that number to countries that are economically or culturally similar to ours, like Canada or the UK, our numbers are dramatically higher than theirs. This is something that has really only come to light in the past couple of years due to some serious issues with how maternal and fetal deaths are documented and recorded in the United States. And that is something that we are still working out and trying to streamline to make it more effective so that these numbers can be more accurate. But this is one of the biggest reasons why I feel compelled to put childbirth education information out there where it is readily accessible and available to everyone. We still have a lot of research to do on this topic, obviously, and we know that it's a multifaceted issue. It's not one thing that's causing this maternal death rate to spike or to be so high, but studies have shown that these interventions becoming commonplace and routine in all childbirth experiences that happen in the hospital may be contributing to this increasing maternal and infant mortality rate. Things like our C-section rate being above 30% in the United States, which is more than double what the World Health Organization recommends. Things like increased induction rates and the use of certain medications. And I'm not trying to fearmonger or terrify you even more by bringing this up. And I do feel like sometimes bringing up the maternal and infant mortality rate works against my mission, which is to destigmatize birth and to normalize it, because I think that hearing those numbers can really frighten people. My point in bringing it up isn't to make it scarier. It's to illustrate the importance of research and education and making sure that we are aware of the different choices and the options that we have, and making sure that we're aware that some of these things that are happening could be a contributing factor. Another part of the problem is access to healthcare, especially in lower income communities. We see some of the highest maternal death rates in these communities. Part of what causes the lack of access to healthcare is the closure of places like Planned Parenthood, which provide maternity services to so many low-income families. You know, we have to fight for the rights and the access to this healthcare for people who need it, because people are dying of things that they could have detected early on in their pregnancy had they been able to see a doctor. You know, people are dying shortly after they give birth because they don't have the healthcare that they need to stay in the hospital long enough for certain medical conditions that they might have. Or people are dying because they are uneducated and they don't know when to notice red flags and they don't have access to childbirth education. So like I said, there are so many different contributing factors to this childbirth crisis. And I know that I can't fix them all, but the part that I can do is to help spread awareness that these things are happening, to help put the information out there, to make it available to people who can use it to make these decisions for themselves. And part of this is on you too. You know, you have the ability to help make a change. And I know it's not easy, but this is one of the most important experiences of your life. You need to stand up for yourself. You need to stand up for the things that you want and deserve, even if they laugh at you. You need to surround yourself with positive experiences and positive energy during your pregnancy and during your childbirth experience. If you surround yourself with negative stories and all the bad things, then that's what you're going to channel and that's what you're going to bring into your own experience. You know, I read something once, and I think that it was in Ina May's Guide to Childbirth, and it says, if you want to have a positive childbirth experience, talk to women who loved their childbirth experience. Talk to the women who say how wonderful and how exciting and how life-changing it was. And I'm not saying don't educate yourself about the scary things, about the harms, about the worries, about the dangers. I'm not saying that. But what I'm saying is, if that's all that you focus on, and if all you do is surround yourself with the scary, negative stories about all the things that could go wrong, you're not creating an environment for a positive experience. So having a positive outlook and a positive mindset can help to make you feel empowered, being informed and educated, having resources at your disposal, creating a birth plan, hiring a doula who can help be a support person for you. We have to start to take childbirth back into our own hands and change the narrative and make it one where birth is a powerful experience that we are capable of, that we are strong enough for, that in most cases is a totally normal, healthy experience that requires no intervention at all. Okay, I'm gonna try to wrap this up, and again, I really apologize if it kind of rambles on or if it doesn't piece together exactly the way that it should, but I hope that I got my point across, and I hope that you guys will be inspired to continue watching the videos that I put out there. Please use the information in this video, the links and the resources in the description below, as well as your own independent research to make informed and educated decisions. Thanks so much for watching. I hope you have a great day.